So we started a new channel and we want to put as much content as quickly as possible out there. So I wanted to pilot test a particular series that did extremely well on my other channel. So let's see how far this takes us. Grab a piece of paper and let's go. Hello and welcome to MK's Exam Secrets. My name is Dr. Moses Kazevu. This is a series on my YouTube channel where we'll look at MCQ questions, true or false, essays on this particular channel on a specific course. In this particular episode, Season 1, Episode 1, we will cover pathology. I don't know if I'm going to separate them as individual things or I'll group all of them together as one. I guess I'll decide after this video has been produced. Before we start going into the details of this, if you haven't yet subscribed to the channel, please hit the subscribe button so you never miss such amazing content every time I post. Tell a friend to subscribe to the channel because we're bringing content to this particular channel. Get your piece of paper. You may pause the video. I will give you time to think through the question. I will give you time to pause before I give you the explanation and the answer. Please note down how much you get so that you can tally your score at the end. Let's begin. Question 1. A 48-year-old woman has a malignant lymphoma involving lymph nodes in the para-aortic region. She is treated with a chemotherapeutic agent which results in the loss of neoplastic cells through fragmentation of individual cell nuclei and cytoplasm. Over the next 2 months, the lymphoma decreases in size as documented on abdominal CT scans. By which of the following mechanisms has her neoplasm primarily responded to therapy? A. Coagulative necrosis. B. Mitochondrial poisoning. C. Phagocytosis. D. Acute inflammation. E. Apoptosis. You may pause the video at this particular moment. Okay, so this is a woman that has a cancer. Remember, lymphomas are malignant cancers and they are going to be dividing rapidly. So you want to give them a drug that's just going to be targeting the cells that are rapidly dividing to kill them off. So cells are dying in a way here. That's what's causing the cancer to actually appear as if it's shrinking. So already you can think of mitochondrial poison. You can rule that out because, yeah, in as much as you would give someone a mitochondrial poison that would potentially kill off the cell. Remember that you do have mitochondria even in your normal cells. So what's going to stop that substance from killing off your normal cells? So it's unlikely that it's mitochondrial poisoning. Phagocytosis, on the other hand, involves the immune system, the phagocytic cells, and that's often going to be happening after the cell has already died. So even though that may be associated later on in the process, it's not going to be the primary reason why the neoplasm is responding to therapy. In terms of acute inflammation, of course, some of these chemotherapeutic agents may cause some injury and they may cause some inflammation because cells are dying, but that's not the primary reason. Coagulative necrosis and apoptosis is one which would leave you in a conundrum, in a debate. So if you look at coagulative necrosis, it's the type of necrosis that happens when you cut off blood supply, such that the enzymes that are responsible for degrading the architecture or degrading the cells have been denatured, such that when you look at this under a microscope, it may actually have almost a near normal architecture. The only thing that may be prominent is the nucleoli will be gone. That's not what we see in terms of chemotherapeutic agents. But from what is being described on the question, we have this neoplastic cells that are being fragmented and the individual nuclei and cytoplasm are being fragmented. If it's individual cells that are dying, most likely those are dying by apoptosis. So your best answer there is option E. Question 2. Which of the following changes are characteristic of irreversible injury? A. Glycogen stores are depleted. B. Cytoplasmic sodium increases. C. Nuclei undergo karyorrhexis. D. Intracellular pH diminishes. E. Blebs form on cell membranes. You may pause the video right now. By the way, there are 20 questions on this, so I will be explaining very quickly, so make sure you pause the video very quickly. So looking at this particular question, remember that when a cell is undergoing certain stress or certain injury, it may either adapt, and the different adaptations like atrophy, hypertrophy, hyperplasia. It may sometimes even to some extent metaplasia. If the cell fails to adapt, it undergoes injury, and this injury could either be reversible, meaning it's characterized by certain things, and if you remove the injurious stimulus, the cell will go back to normal, or irreversible injury, or sometimes it could be a cell that had been undergoing reversible injury that persisted, then it progresses to irreversible injury. Remember, the hallmark of irreversible injury is you have a breach in the membranes. You have a breach in the membrane, the nuclear membrane, you have a breach in the mitochondrial membrane, and you have a breach in the membranes of the lysosomes. Once that has happened, then you know that there's irreversible damage that is going to be happening. Of course, glycogen stores will be depleted even early on with reversible injury, because remember, as these cells are not receiving oxygen, they're not respiring aerobically, they're not even receiving nutrients, so they're going to use up the glycogen stores to compensate. Sodium is going to increase because if you're producing less energy, sodium potassium ATPase pump is working less, so it means that more sodium is actually remaining inside the cell. So that's usually seen quite early in reversible injury, not irreversible injury, but in reversible injury. Get my English right. The pH obviously is going to diminish because with anaerobic respiration, you're going to get a lot of this lactic acid forming. Blebs are usually seen with reversible injury, but once the nucleus has been fragmented, and I don't mean clumping of the chromatin, once the nucleus has been fragmented, that is it. This cell, there's no saving this cell. So your best answer there is option C. The nuclei undergo karyopexis. Question 3. While in a home improvement center warehouse buying paint, a 35-year-old man hears "Look out below," and then is struck on the leg by a falling pallet rack, which strikes him on the left leg in the region of his thigh. The skin is not broken. Within 2 days, there is a 5x7 purple color to the site of the injury. Which of the following substances has most likely accumulated at the site of injury to produce a yellow-brown color at the site of injury 16 days later? A. Lipofuscin, B. bilirubin, C. melanin, D. hemosiderin, E. glycogen. You may pause the video right now. So, this is a person that has been struck by an object. They have experienced some trauma. And remember, with trauma, even though there is no visible cut that you can see, you may sometimes have some of this blood actually seeping out and these red blood cells seeping out. Remember, these red blood cells are going to be consisting of hemoglobin, which is a pigment that often gets broken down, and iron is going to be separated from these areas. Once this iron is separated, it may begin to deposit in certain tissues, and once iron deposits in other tissues outside the reticular endothelial system, it deposits as a compound that's known as hemosiderin. It's bound to a protein, or rather deposited as hemosiderin. So most likely this is hemosiderin. Melanin is a pigment you find in skin. Bilirubin is one of the pigments that is gotten from the metabolism of the hemoglobin, and it's usually, of course, causes yellowish discoloration of the skin and the mucous membranes. Lipofuscin, on the other hand, is this brown yellow material that usually accumulates over time in the lysosomes after mitosis, and it's usually seen in neurons and in cardiac myocytes. Glycogen is, of course, stored in the liver. Question 4. A 50-year-old woman with a history of unstable angina suffers an acute myocardial infarction. Thrombolytic therapy with tissue plasminogen activator is administered to restore coronary blood flow. In spite of this therapy, the extent of myocardial fiber injury may increase because of which of the following cellular abnormalities? A. Cytoskeletal intermediate filament loss. B. Decrease intracellular pH with anaerobic glycolysis. C. Increased free radical formation. D. Mitochondrial swelling. E. None of the above. You may pause the video at this particular moment. I know this is testing so many concepts that you have learned. I know most of you expected me to ask you, what is ischemia? Which of the following are true of apoptosis? That's not what we're going to ask to test the concepts. And here comes the answer. So remember, here blood supply has been blocked because someone who's having unstable angina, they're having this clot that is found in those coronary vessels, which are meant to supply the heart with oxygen. So this has blocked this supply, and the tissues have begun to die. Remember, if you block the supply of tissues, they're going to respire anaerobically, lactic acid is going to be produced, less energy, cells are going to begin to die. But if you reinstitute the blood supply, you may actually even also cause damage. You may cause injury. How does this happen? It's because the oxygen that you're bringing to that area is actually helping forming oxygen-free radicals. So we refer to this largely as reperfusion injury. So the formation of oxygen-free radicals is what's going to be contributing to reperfusion injury. Question 4. Did I say question 4 twice? This is supposed to be question 5, I guess. Right. So question 4. Rather 5. A 43-year-old man has complained of mild burning substernal pain following meals for the past 3 years. Upper GI endoscopy is performed and biopsies are taken of an erythematous area of the lower esophageal mucosa 3 centimeters above the gastroesophageal junction. There is no mass lesion, no ulceration, and no hemorrhage noted. The biopsy shows the presence of columnar epithelium with goblet cells. Which of the following mucosal alterations is most likely represented by these findings? A. Dysplasia. B. Hyperplasia. C. Carcinoma. D. Ischemia. E. Metaplasia. I think I already even showed you the answer for this. So these are just some of the adaptations that happen. Remember, hyperplasia is increase in number of cells, not really size, but increase in number. It's capable of happening under hormonal influence. For example, in the breast, it can happen in the uterus, the smooth muscles. The atrophy, decrease in size, then hypertrophy, increase in size of the cells. Dysplasia, where they actually begin to change their shape and their orientation. Carcinoma is a cancer, ischemia is cutting off blood supply. Metaplasia is where one cell epithelium is changed to another cell epithelium. So the stem cells are reprogrammed to give rise to a different epithelium that is much more resistant to the injury that these cells are being exposed to. So most likely this person has a metaplasia. Question 5. A 71-year-old woman has had loss of consciousness persisting for over an hour. When she becomes arousable, she cannot speak nor move her right arm. A cerebral angiogram reveals an occlusion to her left middle cerebral artery. 3 months later, a computed tomographic scan shows a large 5 centimeters cystic area in her left parietal lobe cortex. This CT finding is most likely the consequence of resolution from which of the following pathologic cellular events? A. Liquefactive necrosis. B. Atrophy. C. Coagulative necrosis. D. Caseating necrosis. E. Apoptosis. You may pause the video at this particular moment. So, if I gave this question to some of my clinical students, I can guarantee you some of them would get this question wrong. Why do I say so? Because people don't want to revise the basic sciences. So remember that when blood supply has been cut off to a certain structure, it will begin to respire anaerobically. Eventually, it will die by a process that's known as necrosis. There are different types of necrosis. So already you can rule out atrophy, you can rule out apoptosis. Caseating necrosis is often attributed with TB, this granulomatous infection, so you can rule that out. So here, the big debate is going to be between liquefactive necrosis and coagulative necrosis. Generally, the rule of thumb is this. In solid organs, if you cut off the blood supply, generally you're going to be having a type of coagulative necrosis because the cells, the enzymes are going to be denatured, so they won't be able to autolyse or get rid of, start to digest the cell. So the cell will have almost its normal architecture apart from the nucleoli that may be missing. But we expect this to happen in the brain, but for some reason it doesn't. Instead, the brain tissue actually becomes liquefied. It becomes liquid-like. So the type of necrosis that often happens when brain tissue is exposed to ischemia is known as liquefactive necrosis. So your best answer here is A. Question 6. A 19-year-old woman gives birth to her first child. She begins breastfeeding the infant. She continues breastfeeding for almost a year with no difficulties and no complications. Which of the following cellular processes that began in the breast during pregnancy allowed her to nurse the infant for this period of time? A. Stromal hyperplasia. B. Epithelial dysplasia. C. Steatocyte atrophy. D. Duct epithelium metaplasia. E. Lobular hyperplasia. If you know histology, I doubt you would get this question wrong rather. If you know histology, if you really know your histology and you paid attention to your histology, especially histology of the breast, this is very easy to work out. So how do we work this out? So they're talking about milk. Milk is probably made up by the lobules that are there in the breast. So it has to be something to do with the lobules. And remember that there are certain changes that happen during pregnancy. There are certain changes that happen during menarche when the periods are starting. There are certain changes that happen during menopause. So usually the changes that happen during pregnancy are due to the effects of progesterone, which actually causes lobular hyperplasia. On the other hand, the estrogen causes the ductal hyperplasia. So most likely the only answer that makes sense here is the lobular hyperplasia. Question 7. A 20-year-old woman had Goodpasture syndrome, which progressed to chronic kidney disease. She is 165 centimeter tall, weighs 55 kg. She now has a blood pressure measurements in the range of 150/90, which is high, to 180/110, which is quite high, but does not regularly take medications. That's a bad thing. Laboratory studies show her blood urea is over 100 milligrams per deciliter. She requires chronic dialysis, obviously. A chest x-ray shows an enlarged heart. The size of her heart is most likely to be the result of which of the following processes involving the myocardial fibers? A. Hypertrophy. B. Fatty infiltration. C. Hyperplasia. D. Fatty degeneration. E. Edema. You may pause the video. So remember that this woman has high blood pressure, hypertension, which is also putting certain demands on the heart, certain stresses on the heart. So there is increase in stress across the myocardium. And remember that cells in the body can be part of three groups. You have the terminally differentiated cells, which are, for example, skeletal muscles. You have the facultative dividers, like, for example, the liver. These can enter into the cell cycle once injured. The terminally differentiated cells, once you injure them, they're just going to be replaced by scar tissue. And then you also have the continuous dividers, which are constantly in the cell cycle. So these ones are like cells of the skin, cells of epithelium, and the GIT. Generally, the heart muscle, which is made up of cardiac muscle is terminally differentiated. So once it's put under stress, it's going to undergo hypertrophy. Cells that are terminally differentiated are incapable of, or not capable of, undergoing hyperplasia. So these cells are going to be hypertrophying. And this is going to cause the heart to enlarge, and because the myocardium is thickened. But if this injury is not taken care of, it would mean that the heart will progress, the heart muscles will begin to thin out, they'll begin to atrophy, and eventually the chamber walls will be very huge. The chamber walls will be very thin, and inside the chamber it will be very huge. So still the heart will be huge, but then with a very thin muscle wall. We call that as dilatation. But of course, we'll cover that when we look at pathologies affecting the cardiovascular system. Question 8. A 22-year-old man develops marked right lower quadrant abdominal pain over the past day. On physical examination, there is rebound tenderness on palpation on the right lower quadrant. Laparoscopic surgery is performed, and the appendix is swollen, erythematous, and partly covered by a yellow exudate. Seems bad. It is removed, and the microscopic section shows infiltration of numerous neutrophils. This could be an acute thing. The pain experienced by this patient is predominantly the result of which of the following two chemicals? A. Complement C3b and IgG. B. Interleukin-1 and tumor necrosis factor. C. Histamine and serotonin. D. Prostaglandins and bradykinins. E. Leukotrienes. And I think that should be compounds related to that. Okay, you may pause the video and tell me the answer. Okay, so that's arachidonic acid there, the HPE TE, arachidonic acid. Okay, so here it's either you know or you don't know. The complement C3b and IgG is an antibody, so it will have nothing to do with pain. If it was maybe things like chemotaxis or maybe things like opsonization, actually, opsonization for A would have been correct. Interleukin A, those are inflammatory mediators. They're not going to be causing you pain. Histamine and serotonin are preformed mediators of inflammation, especially with histamine, not going to cause you any pain. Leukotrienes will cause the bronchoconstriction to some extent. Some of the leukotrienes also act as chemoattractants, but the prostaglandins and bradykinins will irritate your nerve fibers. They will cause the pain. So the best answer there is going to be option D. A 40-year-old woman had laparoscopic surgery with three months ago. Now she has a small 0.5 centimeter nodule beneath her skin at the incision site that was sutured. Which of the following cell types is most likely to be most characteristic of the inflammatory response in this situation? A, mast cells, B, eosinophils, C, giant cells, D, neutrophils, E, plasma cells. Quite an interesting question. This would be very interesting even for my clinical students. You may pause the video. So, given the history that someone has been sutured, remember that sometimes you may use suture material that is not biodegradable, something that cannot be broken down by the body. It's not absorbable, rather, that's a better term. So given that someone has used something that's not absorbable, this is like a foreign body in the body. There's going to be an inflammatory response that's going to be mounted against this foreign body. Initially, it's going to be the neutrophil. But once the neutrophil realizes that it can't get rid of this, the mast cell is going to come. Because this has been 3 months ago. The macrophages are going to come. The macrophages could sometimes even form a wall around this foreign body, and some of them can actually even start to fuse with each other, start to change in shape, and they develop what is known as giant cells. So most likely the cell type is a giant cell because of this chronic inflammation that is in response to the foreign body. Question 10. A clinical study is performed of patients with pharyngeal infections. The most typical clinical course averages 3 days from the time of onset until the patient sees the physician. Most of these patients experience fever and chills. On examination, the most common findings include swelling, erythema, and pharyngeal purulent exudate. Which of the following types of inflammation did these patients most likely have? A, granulomatous, B, acute, C, gangrenous, D, resolving, E, chronic. You may pause the video right now. So this is something that already seems acute. Average of 3 days, that's rather acute, less than a week even, it's rather acute. So most likely these patients have an acute type of infection. It can't be granulomatous, it can't be gangrenous. Resolving maybe towards the end of the infection. It can't be chronic because 3 days is rather a short clinical period for you to consider it as chronic. So most likely these patients have an acute type of inflammation. Question 11. A 56-year-old man has had increasing dyspnea for 6 years. He has no cough or fever. He had chronic exposure to inhalation of silica dust for many years in his job. A chest x-ray now shows increased interstitial markings and parenchymal 1 to 3 centimeter solid nodules. His pulmonary problems are most likely to be mediated through which of the following inflammatory processes? A, neutrophilic infiltrates producing leukotrienes. B, foreign body giant cell formation. C, mast cell synthesis of immunoglobulins. D, mast cell histamine release. E, macrophage elaboration of cytokines. This one here is a trick question. I know most of you are going to go for one particular option, and I already see you guys shouting B at the screen or writing down B at the screen, but that's not the answer. Because this silica sometimes may cause irritation to the alveolar cells and those cells inside the respiratory system, and can actually result in production or can even be engulfed. In the initial phases, the neutrophils will come to the area, and then if they realize that they can't really engulf this, they're going to now call on the macrophages. So it's most likely macrophages that are coming, or macrophage elaboration of the cytokines. The mast cells release an histamine that's usually seen in asthma, conditions like asthma. Plasma cell synthesis of immunoglobulins, unlikely. Question 12. An experiment is conducted in which proliferating cells are subjected to ionizing radiation. The ionizing radiation leads to arrest in a checkpoint that monitors completion of DNA replication. It is observed that there are increased numbers of chromosome abnormalities in these cells. Which of the following is the checkpoint affected by the ionizing radiation? A. From G0 to G1 phase. B. From G1 to the synthesis stage. C. From synthesis to G2. And D. From G2 to the mitotic division. And from the mitotic division to G0. Again here, it's either you know this or you don't. So they remember that G0 is for those cells that are facultative dividers when they come out of the cell cycle and they become stable such that they can re-enter the cell cycle. The synthesis stage is where most of the DNA is actually going to be synthesized. Then you have the first growth phase and the second G phase. So usually the problem is between G2 as well as the mitotic phase. Question 13. A clinical study is performed to determine the incidence of cancer in different countries. The data show that persons born in Japan and continuing to reside there have an increased risk of a certain type of cancer. A risk factor is Helicobacter pylori infection is postulated. Which of the following cancers is likely seen with increased frequency in this population? A. Breast cancer. B. Colon. C. Lung. D. Stomach. E. Uterus. You may pause the video right now. So if you review your neoplasm section, you know that there are certain organisms that are oncogenic, that are possibly going to be causing cancers. One of them is HPV, which causes cervical cancer, human papillomavirus. Another one is Helicobacter pylori, which has been implicated in peptic ulcer disease. It also has been implicated in gastric carcinoma. So it's most likely cancers affecting the stomach. Question 14. A study is performed to analyze characteristics of malignant neoplasms in biopsy specimens. The biopsies were performed on a patient who had a palpable mass lesion on digital rectal examination. Of the following microscopic findings, which is the most likely to indicate that the neoplasm is malignant? A. Pleomorphism. B. Atypia. C. Invasion. D. Increase in nuclear or cytoplasmic ratio. E. Necrosis. Again, I know the options that most of you are going to go for in this particular question because you're going to be having that knee-jerk response that everyone has. So most of you are either going to go for option B, atypia, or even though it does happen in these malignant cells, it's not really the feature that is pointing us towards malignancy. Increase in nuclear cytoplasmic ratio is another characteristic of malignant cells, but it's not the single thing. But remember, what is going to be the single factor that will be distinguishing between something that is benign versus something that is malignant is if this thing invades. If there's invasion, you already rest assured that that thing is malignant. So invasion is most likely the answer, option C. Question 15. A 61-year-old man has a screening colonoscopy performed. A 2.7 centimeter polypoid mass in the rectum is biopsied and the diagnosis as grade 1 on a scale of 1 to 3 and is assessed as stage 1. Which of the following is best interpretation of these findings in this man? A. Unlikely to be malignant. B. Arising from epithelium. C. May spread via lymphatics in the bloodstream. D. Has an in situ component. E. Well differentiated and localized. You may pause the video right now. Again here, you're looking at two things. You're looking at level of differentiation, which is what is known as the grade of a tumor. You have tumors that are well differentiated, which usually have a lower grade, and you have those tumors that are poorly differentiated, which usually have a higher grade. Generally, something that is well differentiated or it looks like the parent tissue, most likely it may not be so aggressive. The one that is poorly differentiated, looks nothing like the tissues, it's going to have a lot of problems. I like to think of it like this. If you have a child and the child looks nothing like the parents and looks like the neighbors, it's going to be a big problem. But if the child looks like the parents, all well and good, no problem. Then the second thing is the staging of a cancer, which is how far it has spread. So the lower the stage, the lower the grade, the better it is for this person. So this tumor is most likely well differentiated and localized. So your best answer there is option E. Question 16. A clinical study is performed of oncogenesis in human neoplasms. It is observed that some neoplasms appear to develop via viral oncogenesis, like I told you, HPV, with serologic confirmation of past infection. Which of the following neoplasms is most likely to arise in this manner? A. Retinoblastoma. B. Small cell anaplastic carcinoma. C. T cell leukemia. D. Prostatic adenocarcinoma. E. Hepatic angiosarcoma. I know this is a very hard thing, right? No, it's not. Okay, so if you look at all these options, the only option that makes sense is option C, because option C is going to be caused by human T-cell lymphotrophic virus. So option C is your best answer there. Then question 17. A 15-year-old healthy girl with no major medical problems notes blotchy areas of erythema that are pruritic over the skin of her arms, legs, trunks within an hour every time she eats seafood. She should stop eating seafood, followed by diarrhea. These problems abate within 3 hours, and then physical examination reveals no abnormal findings. Which of the following immunologic abnormalities is she most likely to have? A. Localized anaphylaxis. B. Cell-mediated hypersensitivity. C. Complement activation. D. Hypergammaglobulinemia. E. Immune complex deposition. You may pause the video at this particular moment. This, even though you're not even a science student, you can guess that this girl has allergies. So it's most likely she's allergic to this and developing a local anaphylactic reaction. So she is localized anaphylaxis. Question 18. A 52-year-old man with chronic kidney disease receives a renal allograft with matching by tissue typing for HLA-DR class 2 antigen. He does not develop rejection as a complication. His serum creatinine remains in the normal ranges. Which of the following immunologic abnormalities has most likely been avoided by this type of typing, the class 2 antigen typing? A. Amyloidosis. B. Cell lysis by CD8 lymphocytes. C. Graft versus host disease. D. CD4 lymphocyte activation. E. Serum sickness. You may pause the video at this particular moment. So using the information that you learned from your microbiology, remember that the class 2 antigens are going to be binding to the CD4 cells. So what you're preventing is activation of the CD4 cells. How I know this is that the 2 and the 4 should make 8. 2 times 4, 8. So it means that the CD8 are going to be binding to HLA type 1, the class 1. So CD8 with 1, CD4 with 2. So the best answer there is D. Question 19. Hypersensitivity reaction or hypersensitivity response of the immune system is noted to be stimulated by release of interleukin 4 and interleukin 5. This is accompanied by eosinophilia, increase in eosinophils. This response is most likely be directed against which of the following? A. Amyloid protein. B. Spirochetes. C. Neoplasms. D. Inhaled dusts. E. Liver flukes. You may pause the video. So most likely this is just testing you to see if you know which of the following things can cause eosinophilia. Most likely we see eosinophilia with parasitic infections and allergic reactions. So most likely it's seen with the liver flukes. The last question, 12 hours after going on a hike through dense foliage, a 40-year-old man notices a slight raised and tender irregular reddish rash on forearm that was not covered by clothing. This rash gradually increases in intensity for 2 days, and then fades away after 2 weeks. Which of the following forms of immunologic hypersensitivity is most likely demonstrated in this patient? Type 1, type 2, type 3, or type 4? You may pause the video. So this man may have probably been exposed to a plant because it has touched his skin, maybe has developed some sort of contact dermatitis, most likely has scraped past poison ivy. So most likely it's getting worse in 2 days indicates that there's some sort of delay, and out of all these, the one that is most likely seen in delayed type of hypersensitivity is type 4. Remember that type 1 hypersensitivity is immediate anaphylactic, type 2 is going to be IG mediated, IgG mediated, where you're making these antibodies against tissues. Type 3 is going to be the immune complex mediated, and type 4 is going to be the cell mediated, or the delayed type of hypersensitivity. How much did you get out of 20? I think they should be 21 because question 4 was repeated twice. Be honest. How much did you get? Don't lie and say you got 20. We know that you didn't get 20. Anyways, if you enjoyed this video, please comment that, give us more, and subscribe to the channel. You'll never miss such amazing content every time I post. To Zambia and beyond, my name is Dr. Moses Kazevu. Until next time, bye-bye.